Thank you for joining us today. I'm Lance Madigan from Intermountain Healthcare's Media Relations team, and tonight we're joined by Dr. Neal Davis, a pediatrician with Intermountain Medical Group, as well as Medical Director of Pediatric Community-Based Care for Intermountain Healthcare. The CDC's Advisory Committee on Immunization Practices, or ACIP, met today in the latest step to give recommendations for an emergency use authorization for the Pfizer COVID-19 vaccine for children ages 5 to 11 years old. Dr. Davis, if you would be kind enough to get us started by giving us an overview of the findings and their recommendations.
Yes, I would be happy to. This is a really important day for children in the United States. As you mentioned, the Advisory Committee for Immunization Practices, which is an independent body that advises the Center for Disease Control on how vaccines are used in our country, they recommended unanimously 14-0 to move forward the Pfizer COVID vaccine for children ages 5 to 11. And so that's a really big deal. In summary, they reviewed the data for how effective the vaccine was. They reviewed potential risks and found overwhelmingly that the benefits outweighed the risks and moved forward unanimously with this recommendation, which is exciting.
So now that we have that recommendation, what are the next steps for the vaccine?
The next steps are that the federal government is working with state and with the state health department here in Utah to be able to disseminate the vaccine here. And it will be that all of that is going to happen within the next several days so that the vaccine should be ready to be given starting next week.
Can you give a brief overview of what Intermountain's plans are for the vaccine distribution?
Yes, it follows along those lines. Intermountain, as well as other systems, have been partnering with the Utah Department of Health, who's done an outstanding job of coordinating with the federal government as well, I might add, to be able to make sure that we have access to these vaccines. And so vaccines will be shipped here and distributed, and they will be in clinics and in other locations as well, to be able to give to children ages 5 to 11-year-olds starting next week.
And how do parents find out? I mean, is it expected to be in every clinic, or should parents check with their provider, or what's the best way to go about finding the vaccine?
It's a really good idea to check with your provider. So Intermountain clinics are planning on having the vaccine. It's going to be important to call your local clinic to find out how to sign up and get that for your child. Other clinics as well around the state are going to be having plans as well. So it's always a good idea to touch base with your child's medical provider clinic to find out the system for being able to get the vaccine. It's also important to know that there will be other venues to get the vaccine as well. Primary Children's Hospital has a shot spot in the Eccles Outpatient Center where the vaccine will be given, and as well as the community pharmacy at Primary Children's. I also should add that other pharmacies around the state are prepped and ready to follow the same chain of events to give the vaccine as well.
Okay, so talking about the vaccine itself, how is the vaccine different for children as opposed to the vaccine we've seen so far?
The effect is the same, and that's really important to emphasize, that the vaccine is 90% effective at preventing symptomatic disease for children, and that's a really important thing. The way the vaccine is prepared is 1/3 the strength, and the reason is that children are smaller and also their immune systems tend to respond more robustly. And so it's really good news that even at 1/3 of the, I guess you could say, the strength of the adult dose, the effect is the same.
And do we know, are children going to need multiple doses or multiple vaccines?
That is correct. So similar to the other age groups that are able to get the Pfizer vaccine, there will need to be 2 doses separated by 3 weeks.
And I know you have your own clinic, and as a practicing physician, pediatrician, how do you approach the conversation with parents talking about vaccinating their kids?
First thing I should mention is that a lot of parents are really excited for this moment. And I want to emphasize that this is a big day for children in the United States. Children have been impacted by COVID, both directly by its infection and also its impact on schools and other parts of their life. And this is a really big step forward to be able to make the lives of children better. And parents in general are quite excited about that. It was interesting in my clinic today, like the moment that the vote must have happened, I had a parent say, "Hey, I just saw this came through. Help me know how I can get the vaccine." That is by far the response that I'm seeing.
Wonderful. And as I understand it, and maybe you can speak to this, the vaccine can be given just like the flu shot. The COVID vaccine can be given with other vaccines for children at the same time.
That is correct. There's no need to space out any vaccines with the COVID vaccine. It can be given at the same time as other vaccines. Many people also wonder if their child need to get the vaccine if their child had COVID. And the answer is yes, there is much stronger protection that happens with the vaccine. That is some of the data that came forward. And so parents have been asking me that question. I've been waiting for this data. And it seems very clear that the answer is absolutely get the vaccine, even if your child had COVID. This provides added protection, including for the Delta variant, which is very important.
Maybe speak to that just a moment. What is the effectiveness of the COVID vaccines for children in preventing illness and spreading disease, in preventing hospitalizations and that protection?
So the study that was done showed that it was 90% effective at preventing symptomatic disease in kids, which is a very good response. There were no hospitalizations in the study and no deaths. And so that's useful information as well. There were also no serious side effects in the study as well. And so all things considered, taking a look at that data, some of the other data that has been collected more broadly, the Advisory Committee for Immunization Practices again found that the benefits of this vaccine far outweigh its risks. I think it's really important to remember that even here in Utah, we've had over 100 children that have developed that multi-system inflammatory syndrome, for example. And that's a big deal. That impacts the heart and other organ systems. We've had over 600 children hospitalized with COVID. So it's true that children are less impacted than at-risk adults, but it's also true that children are definitely impacted from this virus, and being able to get this protection is a really important step forward.
You spoke a little bit about the side effects of vaccines. What are some of those side effects that you might see in children? And at what point would parents need to be concerned if they, or at what point do you think that they should parents see a doctor if they have concerns?
Great question. So parents in general are used to their kids getting vaccines. And as a general rule of thumb, the COVID vaccine has similar side effects as other vaccines. Kids can feel a little achy for a couple days. They can have fevers for a couple days, especially after the second vaccine. Actually, remember there are 2 doses that are given. And so those kinds of things, honestly, parents are used to with vaccines anyway. And so just managing those things with acetaminophen or Tylenol or ibuprofen can be a great way to go. And that generally helps kids get through just fine. If there's anything that seemed more pronounced than what they've seen in the past with other vaccines, it's always okay to check in with the child's medical office and ask questions. That's an important message too.
And while we're on side effects, we've just got to do a little myth busting. Heard about infertility or affecting development. What do you have to say on those subjects?
Um, what you said is true. There tend to be common myths with vaccines, and that is not different in this case. There's no evidence to support those claims. The vaccine is very safe. And again, the benefits far outweigh the risks for giving the vaccine. So for example, my own children are older than the 5 to 11 age group, but we got the vaccine as soon as we possibly could. And so now for those parents who've been waiting for those kids who are 5 to 11 to have this opportunity, this is a really big deal to be able to have this protection for their children.
We've got a couple questions from some of our media friends. I'm not sure if you'll be able to answer these, but we'll throw them out to you anyway. First off, could shots be available sooner if the CDC director signs off tonight or tomorrow?
That's a great question. I would have to check with the Utah Department of Health and that team. I know they have been working very closely with the federal government for this moment. And so I am not sure, but that is where I would look for information, is the Utah Department of Health.
I expect vaccines.gov would probably be helpful there as well. But
Yep.
Another question kind of along the same lines. Do you know how many doses Intermountain will be getting, or Utah in general for that matter?
I don't know the exact number of doses. I know that teams, both again from the Utah Department of Health and with Intermountain system teams, are working to get the vaccines as efficiently as we can. The good news is that the federal government has secured a significant number of these vaccines already for distribution. And so it's important to know that there will be vaccine for your child, for any parent who's concerned about that.
And kind of a follow-up to that, do we know when the vaccines will be delivered?
I don't know exactly. Again, those logistics have been really worked on with the Utah Department of Health coordinating with the federal government.
Sorry about that. I wasn't sure if you'd know those logistic questions, but I
Yep.
was going
Good
to
question.
ask.
They're very
Last,
good.
and
I do know that my own clinic is gearing up for next week, and we're really excited to be able to do that for our patients and families. And I know that many other pediatric providers around the state feel the same way. This is a really important day.
I believe I've heard most information saying that Intermountain is planning for November 8th as our start date. But another question is asking if parents can start signing up their children now for appointments to get the vaccine.
Yes, I think that a lot of clinics are creating schedules already to sign up kids to be able to get the vaccine. So, for example, I know my clinic is, and I know that's the protocol, that's the procedure that's going out. And so, again, whether it's an Intermountain Clinic or another clinic that is providing the vaccine, I know that those things are moving forward. So it's important, again, to touch base with your child's, with the child's medical office, be able to understand the local logistics. But the answer to your question is yes.
Great. Then I think you already touched on this, but I'm going to ask again. What have you been hearing from parents of your young patients about the vaccine?
Again, I really want to emphasize how many parents are really excited to be able to get the vaccine for their kids 5 to 11 years old. As I've been talking about this over the past several weeks and months, we've been saying, okay, let's make sure that the data is showing what it has shown today, that it is very effective and that it's safe and that the benefits far outweigh the risks. And that's very clear at this point. And so as I've had those discussions over the past weeks and months, again, today is a really great day because the anticipation has borne out and the vaccine does seem really ready to go. So that is by far the line of discussion that I've been having with my patients.
Awesome. And then also as a pediatrician, how do parents identify, or what would you tell parents to look for if they were concerned that their child was exposed or possibly came down with COVID, and at what point should they be tested?
Great question. The tricky thing with COVID is that its symptoms overlap with so many other things. And so even if it seems to be symptoms similar to a mild cold or a more aggressive cold or fevers and chills, those symptoms all could be COVID. And so the general rule of thumb is that it is always a good idea to test to get that information so that you know how to manage your situation as a family.
Wonderful. Looks like that was the last question that we have today. Again, for those that have joined just a little late, we're talking with Dr. Neal Davis. He's a pediatrician with Intermountain Medical Group, as well as medical director of pediatric community-based care for Intermountain Healthcare. We've been talking about the ACIP's recommendation, unanimous recommendation for 5 to 11-year-olds to receive the COVID vaccine, and we're expecting to see those shots here shortly. So we appreciate everyone's participation today. We'll follow up as usual with the video recording for those members of the media, and encourage everyone to go out and be vaccinated. Maybe I should ask, Dr. Davis, do you have any closing thoughts?
I hope I've expressed my enthusiasm adequately for this moment. COVID has disrupted all of our lives, and children very much so as well. And so this is such an important day to extend the protection that we have in our time with the science and technology that we have to help protect them, to unlock and unleash their lives. And it's important, I think, for the rest of us in the community to continue to step up and do what's required to get the vaccine ourselves and the other precautions so that we can see our current rates of the Delta variant cool off. That will allow us to continue to move forward and will make a difference for children as well.
Wonderful. Thank you again, Dr. Davis, and everyone else for joining us. We'll conclude our press conference at this point. Thank you very much.